Hello, everyone. Good evening. My name is Carolina Echeverria, and you received emails from me. Thank you so much for being here with us. I just have two housekeeping items before we get started. The first one is the Q&A. If you do have a question, you can ask your question anonymously or not. You will click on where it says anonymously, and you can submit your question anonymously. The questions will not be answered live. It just gets very distracting. It's a second conversation, but we will gather all of the questions and they will be answered afterwards and shared with the recording. Also, as you heard, the webinar is being recorded. So you will get the recording if you signed up, and then we will keep it in our YouTube channel. And without further ado, I want to introduce Dean Eileen Freibauer.
Thank you so much, Carolina. It's great to be here with everybody tonight. So good evening, alumni, partners, faculty, and administrative colleagues, families, and students. It is my honor to welcome you to the State of the School Address for the 2025-2026 academic year. This evening, I want to share where we stand as a School of Nursing and Health Professions. I want to share the challenges that we face and the opportunities that lie ahead. As we look at the landscape of healthcare and higher education in late 2025, one thing is clear. It is not business as usual in any way, shape, or form. Our School of Nursing and Health Professions stands at a critical juncture, uniquely positioned to lead, yet we're facing real challenges that demand our strategic attention and a collective resilience. Our mission remains clear, however. We seek to improve the health of all populations through equitable and compassionate service, value-driven research, and innovative nursing and health professions education, preparing learners to use their hearts, minds, and souls to change the health of the world. As I've noted previously, one of the most important functions of a leader is to identify a competent and trustworthy team of professionals to partner with in the administration of an organization. I am very fortunate to work with an extraordinarily gifted executive team. This team, along with very talented and committed faculty and staff, ensure that the School of Nursing and Health Professions continues to provide an exceptional educational experience for all of our students. It is no secret that locally, nationally, and globally, we are operating in an environment of unprecedented change, driven by significant social, economic, and political forces. These forces combine to directly impact our students, our graduates, our faculty, and the communities that we serve. We do not exist in a vacuum. As the Chinese proverb says, the flapping of the wings of the butterfly can be felt on the other side of the world. In healthcare specifically, the challenges are significant and policy uncertainty looms large. Federal departments that play a significant role in the administration of healthcare services and that govern the education of nursing and health professionals are being reshaped, requiring significant real-time adjustments by institutions. And while we hear of workforce shortages in nursing and public health, the landscape is far more nuanced with uneven and inefficient distribution of these professionals across the nation, leading to both shortages and surpluses in different geographic areas, with shortages in rural and underserved areas and surpluses in urban centers, and sectorally with shortages in settings like long-term care facilities and home care versus surpluses in some hospitals. This makes the employment market even more difficult for our graduates to navigate. The problem is exacerbated by factors like an aging workforce, increased demand, and what we call the experience complexity gap. The experience complexity gap describes the widening difference between the decreasing average level of nursing experience in the workforce and the rapidly increasing medical complexity of patients that they care for every day. This gap is the direct result of a loss of experienced nurses due to retirement, coupled with a significant percentage of new graduates leaving the profession early in their career, often due to reality shock and the inability uh, to adjust to the changing demands of the workplace. And this further depletes the overall experience level of the workforce. In higher education, we must navigate rough waters. You may have heard about the demographic cliff in higher education, which refers to the projected steep decline in traditional age college students due to declining birth rates that began after the 2007 recession. This is expected to cause a sharp drop in college enrollment starting now and continuing well through the next decade through 2041, requiring significant adjustments to enrollment strategies and which will have implications for USF as an institution, as well as the College of Arts and Sciences and its professional schools. We are also experiencing substantial changes in how students will be able to finance their education at the undergraduate, graduate, and doctoral levels. This will further strain access to education and the development of a robust nursing and healthcare workforce. As a result, and as this diagram shows, the School of Nursing and Health Professions is strongly impacted by these two overlapping environments, the current state of higher education and the current state of health and healthcare and public health. Although schools that provide education in nursing and health professions often focus most of their energies on understanding the professional healthcare industry, these schools exist within a higher education ecosystem, which has important implications for their trajectory. And we in the School of Nursing and Health Professions are no different. So charting the course for the School of Nursing and Health Professions requires us to navigate these coexisting and sometimes competing contexts. And let me tell you, it is a challenge in this day and age. But even so, the USF School of Nursing and Health Professions remains a bedrock of resilience and expertise. Our school is a vital pipeline for a robust healthcare workforce in the Bay Area and beyond. We are proud of our high-quality educational programs, which continue to attract dedicated individuals to nursing and the health professions, particularly public health. Our graduates are known for their competence and compassion, making a difference in hospitals, clinics, and community settings in the region, the state, and the nation. And while challenges exist, we recognize that with every challenge comes opportunity. Tonight, I'm going to share with you how we are embracing interdisciplinary collaboration, integrating technology, social sciences, and clinical practice. We are expanding our community partnerships, addressing health disparities, and building trust. We are fostering academic practice partnerships, ensuring that our education remains relevant and meets the evolving needs of the healthcare industry. We are leading in policy advocacy, ensuring nursing and public health voices shape the national conversation. We are innovating in education using simulation, artificial intelligence, telehealth, and virtual nursing to prepare students for the future. We are preparing our students for global health engagement and equipping them to respond to crises at home and abroad. And I am very pleased to report our latest rankings from US News and World Report. And I'll note that the BSN ranking is one of the highest rankings that USF has ever had in any program. So as you can see on this slide, the BSN program ranks 19 out of 686 nursing programs in the country. That places us in the top 3%. We are second only to UCLA in California, and we are the top ranked private institution in California. Our online MSN program ranks 16 out of 211, top 7.5%, and we're the top program in California. Our master's entry program, so this is a program where individuals come to us having already received an undergraduate education, and they've made the determination that they want to become a nurse, and so they join us at the master's level. This program ranks 27 out of 158, placing us in the top 17%. Also the top ranked institution in California for this type of program, and second only to UCSF and UCLA in California. Our DNP ranks in the top 33%. Our MPH ranks in the top 25%. And our PsyD program ranks in the top 41%. I'm extremely proud of our faculty and staff who deliver such high quality education that is recognized by our peer institutions as well as other institutions across the nation, and our student outcomes are reflective of their efforts. With this background, then I would like to share some information about the current state of the school. But first, I want to remind you of our mission, vision, and values. The mission of the School of Nursing and Health Professions is to improve the health of all populations through equitable and compassionate service, value-driven research, and innovative nursing and health professions education, preparing learners to use their hearts, minds, and souls to change the health of the world. We believe, as our vision statement, that we can eliminate health inequity and we can promote health justice locally and globally while preserving human dignity. And lastly, in concert with the values of our parent institution, the University of San Francisco and Jesuit tradition, we value courage, the courage that to challenge existing paradigms, to advance health equity and achieve health justice. We value community that fosters collaborative action for positive change. We value diversity in all its forms to ensure inclusivity and belonging. We value excellence that instills responsibility, accountability, professionalism, and a desire for personal growth and lifelong learning. We value ethical practice that reflects humanistic ideals and upholds the inherent dignity and worth of each individual. And we value scholarly inquiry that seeks the best evidence and promotes the highest levels of scientific integrity. I also want to take a moment to remind you of our current portfolio of educational programming across our 3 campuses: our San Francisco campus, known as the Hilltop campus, Sacramento, and Orange County. And I want to provide you with some updates on this programming. So as you may recall, we have that Bachelor of Science program in nursing. We have what we call traditional direct entry, which allows students to come to us straight out of high school to enter in as first-time, first-year students or undergrads as freshmen. We have a transfer program that welcomes individuals predominantly from the community college system and allows them to come and join us to complete their baccalaureate degree in nursing. And then we also have what we call our 4+1 program in nursing, and that allows our students to elect to stay with us an additional year and receive a Master of Science in Nursing. We have our Master of Science in Nursing program. We have a partnership, a long-time partnership that we just celebrated our 10-year anniversary with Kaiser Permanente. That is a cohort model where we offer a Master of Science in Nursing to those nurses who work within the Kaiser system. We have our separate Master of Science nursing program that is an online program that we offer to various students that want to attend USF to gain their graduate degree in nursing. And this allows individuals that have an associate degree in nursing or a baccalaureate degree in nursing to come in and get their graduate degree. And then we have our Doctor of Nursing Practice program. We have several different tracks associated with this program. Our students can enter into the Family Nurse Practitioner program, the Psychiatric Mental Health Nurse Practitioner program, or the non-nurse practitioner track, which is a DNP in Health Systems Leadership. This particular program has three different avenues that students can pursue. One is in education and simulation, one is in management, and one is in population health leadership. For our nurse practitioner students who are getting a Doctor of Nursing practice, typically the population health leadership track is the track that they pair with their nurse practitioner education. The education and simulation track is a very innovative track that prepares individuals to serve in either faculty roles for nursing schools and nursing programs, or to serve as professional development specialists, educators within the healthcare system. We're very excited about all of these offerings. And really importantly, for this new year, this academic year 25-26, we started offering a postmaster's certificate for both of our nurse practitioner programs, the family nurse practitioner, as well as the psychiatric mental health nurse practitioner program. This allows individuals who have a master's in nursing to come and just complete the coursework needed to become certificated as a nurse practitioner in the state of California. This is our effort to try to improve access to care in our state. And we are really excited about a unique interdisciplinary partnership that we have with the School of Management. Within our DNP Health Systems Leadership Program, we have the management concentration, but our students also have the opportunity to do a joint degree program where at the same time they can also obtain their Master's of Business Administration. The offering of this program places us in a very small group of institutions across the country, only about 8, that offer both the DNP and MBA as a dual degree option. And we are the only one on the West Coast. So we're very excited about this, bringing this to bear this year. And coming in 26-27, those of you who I've had a chance to talk with, or you've heard me speak in other forums, you know about the implementation of the new essentials. These are our educational standards that are required by our accrediting body and our professional organization, the American Association of Colleges of Nursing. We will be implementing the new curricula beginning the fall of 2026. And I'm going to speak a little bit more about that in just a moment. In our health professions department, we continue to offer our Bachelor of Science in Public Health. You may remember that we started this program in 2023. This is a bright, shining example of what we're capable of doing at USF. This is one of the degree programs that has been met with great enthusiasm, and we've seen our enrollment surpass what we were anticipating. Just like our BSN program, we bring students in through a traditional entry process as first-time, first-year students. We also offer it to transfer students. And just like our nursing students, we have the 4+1 option, or the ability for students to receive both a BS in public health and then do a master's in public health in 5 years. Our Masters of Public Health program has undergone some changes over the last few years as we've seen changes within the broader public health sector itself. And so previously, we have offered a number of different concentrations. We have decided to pare back those concentrations. This year, we are actually going to be graduating the last cohort of our behavioral health concentration. In the academic year 2026-27, our public health program will also be moving to a new curriculum. And we will be offering what we characterize as a generalist Master of Public Health. We believe that this will prepare our graduates for many different opportunities within the public health sector, not simply working within, say, county public health departments, but working for third-party payers, working in industry, and gives them a much broader understanding of the entire sector. And our goal is to prepare them to be able to work in a number of different settings. And again, as I said, the healthcare environment, the healthcare industry is moving extremely fast. We have, as a result, you may recall that we used to offer a Master of Science in Digital Health Informatics. We have ended that program or sunsetted that program. Our last cohort just graduated this last academic year. This space is a very active, dynamic space, and sometimes it's a little bit difficult for a degree program to keep up. And so we are reassessing this space as we continue to grow and evolve within the school. And then we also have our Doctor of Clinical Psychology. The program admitted its last new cohort in the fall of 2024 and is now in a teach-out process. Our students in that program and our faculty in that program continue to receive and deliver an extremely high quality educational experience for these students. And we are thrilled that we continue to be able to provide the resources needed to ensure that these graduates will be able to go out and make significant contributions to the care of individuals, particularly in underserved communities, and provide them with exceptional mental health services. And now I'd like to tell you a little bit about who's with us right now during this academic year. As you can see from this slide, our total enrollment for fall of 2025 is 1,595 students. If you look at the graph, you can see that we are definitely on an upward trajectory with enrollment. The area that is circled on the graph reflects our enrollment during the fall of 2021, fall of 2022. These were periods of time, as you may remember, wasn't that long ago, 5 years ago, that we were in the midst of, entering into the pandemic or COVID. And so we certainly saw a decrease in enrollment during that time. And the recovery period post-COVID has been an interesting time. Institutions have had to sort things out. Students have had to sort things out. And so we're starting to see that landscape sort of settle out from the impacts of COVID just in time to take on the impacts of everything else that's happening that I described earlier. But as you can see, from fall 23 to fall 24 to fall 25, we continue to see that upward trajectory. 69.5% of our students are our undergraduate students. And I'm sorry, that's a typo on the public health students. We have 170 public health students, not 17. In the master's program between our public health and nursing, it's 21.5% of our student body, and our doctoral students represent 9% of our student body. And consistent with the university's 2025 US News and World Report ranking as the most diverse university in the nation, the student body of the School of Nursing and Health Professions reflects the rich diversity of our state and nation across all of our programs. This pie chart you can see for each of the categories of our student: undergraduate, graduate, and doctoral student. You can see that we have significant diversity. We have what we would call a plurality of backgrounds among our students. And this is incredibly important as we recognize that increasing diversity within nursing and health professions is so important for the healthcare, for delivering healthcare and providing healthcare to our larger communities. Evidence tells us that a more diverse healthcare workforce improves care by improving patient trust and communication. It leads to better health outcomes, particularly for underrepresented groups. Diverse teams also bring varied perspectives to care, which enhances problem solving, patient engagement, and the overall quality of care can help address systemic health inequities and disparities and by influencing the healthcare environment. So we are extremely proud of our community and all of the richness that this brings to the learning experiences for our students. The context in which the school operates requires nimble and timely action, which unfortunately strains resources and relationships at time. You know, agile is not a word that is often used to characterize higher education, but as I described earlier, the context is such that the world is moving very fast around us, and we need to move fast as well. As administrators, faculty, and staff move forward, we prioritize two principles to guide us: to always seek the best evidence to inform our decisions, and to center the experience of our students, our faculty, and our staff in our responses. For example, this past year, we restructured our administrative team to ensure that we had the resources to deeply analyze data to help us understand our student population and student performance in a much more nuanced and comprehensive manner that allows us to improve efficiencies across the school as well as effectiveness in all of what we do within the School of Nursing and Health Professions, and also ensuring that we are providing the right resources to the right students in terms of those who need them at the right time. And in that vein, I want to highlight the intentional and deliberate work undertaken by our nursing department as they have prepared to implement the new Essentials competency-based curriculum. Recognizing the need for a conceptual model that could underpin the curricular transformation, our faculty has created a model that addresses disciplinary knowledge, ethics, regulatory and accreditation standards that are anchored in an ontological competencies that are resting on the foundation of the Jesuit tradition. This tradition integrates learning, faith, service, and caring for the whole person, character, and conviction, religious truth, and interfaith understanding, and a commitment to building a more just world. Similarly, our public health faculty have recently published a paper that applies Jesuit principles and practices to public health practice and leadership. Their proposed framework outlines 10 leadership principles: inclusive leadership, service to others, care for the whole person, otherwise known as cura personalis, striving for the greater good, otherwise known as magis, self-awareness, discernment in decision making, cross-sectoral and community partnerships, global citizenship, lifelong learning and growth, and adaptability and innovation. This Jesuit-inspired framework offers a spiritual and values-based approach to cultivating compassionate, resilient, and effective public health leaders. And that brings me to the most exciting part of this presentation tonight. Moving into the second half of this decade, I am reminded how fast time flies, given that our freshmen, those who joined us this semester, fall of 2025, are the class of 2029. As a result, we must not only focus on preparing practice-ready nursing and health professionals, but we must focus on preparing future-ready nursing and health professionals. This preparation of this workforce must take place in an evolving and resource-constrained environment. This means thinking differently about how we educate our learners. So I hope this model looks somewhat familiar to some of you. I have relied on the double helix structure of DNA as a metaphor for evolution of the School of Nursing and Health profession. Like the structure of DNA itself, this model symbolizes a backbone, adaptation, evolution, growth, and resilience. As such, it perfectly illustrates the future of educational programming at the school, programming that will lead the school into the rest of this decade and beyond. From a historical and academic perspective, the disciplines of nursing and public health are intertwined. As a result, from a practical resource utilization perspective, this model pushes back against limitation and allows for us to think more expansively, ensuring interdisciplinary collaboration, which is the mainstay of today's and even more so the future's healthcare environment. Under this framework, a learner's relationship with the University of San Francisco and the School of Nursing and Health Professions can potentially begin through one of our growing pre-health partnerships, such as our Certified Nursing Assistant program with two Cristo Rey high schools in the Bay Area. The program has been on pause for the last couple of years, and we are able to bring it back to life starting this next summer. Once admitted to the School of Nursing and Health Professions at the bachelor's levels, our learners will complete nursing or public health undergraduate degree requirements and have the opportunity to take classes with students in the other degree program, as well as be taught by faculty from other health-related disciplines. Given the synergy inherent between nursing and public health, pathways currently exist and will be further developed to allow learners to seamlessly seek higher education in their primary professional path or cross over to earn a degree in the second discipline. At present, the School of Nursing and Health Professions offers 5 of the 6 degrees that are evident on this model. The school will develop a new Doctor of Public Health Practice degree with planned implementation timeline of fall of 2027. What this model demonstrates is that somebody could come into the school, start out with a Bachelor of Science in Nursing, move into a Master of Public Health, and perhaps move back to a Doctor of Nursing practice. Or perhaps instead of a Doctor of Nursing practice, receive a Doctor of Public Health. Perhaps they start as a student receiving a Bachelor of Public Health, and they decide that they really want to be involved in direct care. They can move over and enter into our Master's Entry Nursing program. And then maybe they want to move into the doctor of nursing practice, or they want to move into the doctor of public health practice. The key here is that we are working to develop pathways that are seamless, that allows students to that will eliminate some of those barriers of moving from a bachelor's to a master's to a doctorate, allowing for some credit to carry forward so that it really creates an opportunity for our students to find their passion and pursue it to the final terminal degree. Throughout their educational experience, students are and will continue to be exposed to the partner discipline through courses, through work with faculty, through clinicals or practicum experiences. And these are all represented by the strands of the helix. Just as the amino acids are the building blocks of the proteins encoded by DNA, I bet you didn't realize you were going to get a little bit of a biology tutorial tonight. These expansive interdisciplinary learning experiences will form the foundation of a learner's educational journey that will prepare them to work across the continuum of healthcare. This will future-proof them. It will provide them with opportunities to refine skills that will support professional adaptation as the healthcare industry evolves at breakneck speed. And building on the legacy of the nursing programs and their synergistic disciplinary and academic concordance with public health programs, the School of Nursing and Health Professions will leverage professional educational tracks to create these mutually reinforcing and seamless pathways. We are creating leader practitioners for nursing and public health. Central to this vision is our focus on developing centers of practice excellence, building on the expertise of our faculty and the needs of our communities. As a pediatric nurse practitioner and clinical specialist by education and experience, I am committed to ensuring that the children in the Bay Area receive high-quality, evidence-based healthcare that is foundational for healthy growing and development. And as we know, the aging population is the fastest growing population in our country, and we must ensure access to care that promotes healthy aging, especially healthy aging at home and in a familiar community. Through our relationships with clinical partners and various agencies and entities, we are creating environments that support the development of specialized practice expertise in these areas. We are particularly excited about new and continuing partnerships with Kaiser Permanente, Alameda Health Systems, San Francisco Public Health Department and Health Network, John Muir Health Systems, Sutter Health, Stanford Health, UCSF Health, the Veterans Health Administration, and our newest partner, the City of Oakland Office of Aging. In collaboration with Oakland, we are creating a network of nurse-led community clinics that will provide much-needed health education and care to an aging and unhoused population at 4 locations in Oakland. In addition, we are doing all of this within a technological ecosystem that changes daily, especially given the rapid infiltration of artificial intelligence into the healthcare space. New nurses and health professionals must be confident in working with AI without becoming dependent on it. Learners must be exposed to AI during their educational journey in order to ensure that they learn to think critically, make independent decisions, and embrace AI as a supportive partner rather than a substitute for clinical reasoning. Early exposure will build confidence, will sharpen their judgment and help them learn how to partner, using AI. This will ensure that these new professionals step into roles ready to deliver safer, faster, and more informed care. It will enable them to do less harm. Medical error is the third leading cause of death in this country. Technology will allow us to improve the quality of care across the board to individuals. As a result, we are aggressively integrating AI into all that we do within the School of Nursing and Health Professions, whether it be in the classroom, in the immersive learning environment, or in our administrative offices. All of us, administrators, staff, faculty, and students, are leveraging AI in new and important ways to support our end goal of educating a compassionate, ethical, and future-ready nursing and health professional workforce. AI will not replace these professionals, but nurses and health professionals who do not or cannot use AI will be replaced by those that can and do. My goal is to make sure that each student that leaves the School of Nursing and Health Professions, whether it be with a bachelor's degree, master's degree, or doctoral degree, is AI literate and can leverage this new technology in ethical ways that allow them to provide the best care possible to the communities that they serve. There we go. Couldn't advance my slides there for a second. So I acknowledge that the road ahead may be challenging. It requires vigilance and proactive engagement. The social, political, and economic currents may shift, but our mission to educate the next generation of nursing and health professions leaders remains steadfast. At USF School of Nursing and Health Professions, we are uncompromising in our commitment to our core values: courage, community, diversity, excellence, ethical practice, and scholarly inquiry. By fully embracing these values, we create an environment where future nurses and healthcare professionals can thrive and make impactful contributions while prioritizing inclusivity. We envision a healthcare landscape that exemplifies courage and community, in which diversity is not just acknowledged, but celebrated and embraced, and every person is treated with dignity and has access to care that allows them to lead flourishing lives. This vision isn't just aspirational, it's achievable. Thanks to our faculty and staff and our rigorous programs that push for ethical practices and always pursue excellence. I am so humbled and inspired and simply thrilled to be leading the School of Nursing and Health Professions towards a healthier and more equitable world. Together with you, our alumni, our community partners, our families, our students, we are making a significant impact that resonates with individuals and across communities. I sincerely thank you for your time this evening. And as Carolina stated, we will be providing you with answers to your questions when we send out the recording of this presentation. I thank you again, and I'm going to turn it over to Carolina.
If the healthcare system were a patient in this country, I would say that it's on life support. And it's been on life support for quite some time. There are a number of things that we need to do to improve the system as a whole. But I'm very hopeful that with the attention on whole person care, that we can move our healthcare system from being really a sick care system to truly being a healthcare system where we can prevent illness. It's all about equity. It's all about compassion. It's all about serving another human being. And so it fits very well with our role, our purpose, our mission here at USF.
I work at Adaptation Health. I'm the Senior Director of Clinical Research and Operations. When I was hired into this role, it was to create their clinical research division under the decentralized trial realm. And it allowed me the opportunity to really focus on a new way of doing things. Years ago, using your phone to speak to your doctor, to answer survey questions, to let them know how you are feeling, using a wearable device to be able to get your blood pressure, take an ECG reading, things like that was not even heard of. Now we can use all of those to run that entire trial. Traditionally, a lot of trials are done at major academic centers. I spoke to a clinical trial participant who was flying from Green Bay, Wisconsin, all the way to Florida weekly. And so when you start thinking of health equity, who is able to take off work, it limits your demographics of who can participate. In a leadership role, trying to change clinical trials for the better, for the participant, and to advocate for the participants, that's something that I do every day. And I'm thankful that that's something I was empowered to do while I was at USF and after I've left.
Throughout college and kind of just my professional career, I always had an interest in criminal justice and how to really help people on an individual level. And then as I started to work for the court, found this really interesting approach where they were trying to bring therapeutic components and a lot of things that healthcare was doing into the criminal justice system. And we saw a really interesting similarity. Everyone wanted to help. There just wasn't kind of this coordinated component bringing everyone together. AQRI is my nonprofit that launched in February 2023. AQRI works at the intersection of the courts, public health, and community resources to really understand how to improve outcomes in the justice system. So we do resource referrals, building relationships with the community. We do a financial assistance track where we incentivize behavior change and can pay for things like DMV applications and housing fees. Then we have a pretty robust mentorship program where we match clients directly with professionals at tech companies to kind of improve their soft skills when they're looking for employment. Everyone wants a pretty similar outcome, right? People don't want to commit crimes, people don't want to be incarcerated, people just want to be able to thrive in the community, pay their taxes, keep their money, and go home to their families. We can elevate the type of care and build up the skill so clients have agency to be successful with their health and in the community.
Ever since growing up, I knew I wanted to be a nurse. My mom was a nurse, but in 2016, my mom actually had breast cancer. And so experiencing that, it had exposed me to a different side of care that I was unsure of. So my idea of healthcare was just treatment in the hospital. But when my mom actually went home, I was sort of responsible for helping her with care outside of treatment. And yeah, that definitely influenced my career path. I chose USF for the location and the clinical opportunities to magnet hospitals in the Bay Area. Being able to have clinical rotations at these hospitals allow you to not only connect with the nurses, but it also gives you an opportunity to see how it feels to be in such like a rigorous hospital setting. A specific rotation that has allowed me to gain a better understanding of the type of care I want to deliver was in the heart of Chinatown, and everyone in my clinical block had no experience with the language, but through this clinical experience, I feel like that was the most impact I've made with the patients. It has allowed me to understand that each patient needs an advocate for their specific needs of care.
So here at BART, my role is to provide medical services for patients who are suffering with opioid use disorder. Most of these patients have been neglected by all other providers and the healthcare system in general, just by the nature of the severity of their illness. And so I have an opportunity to sit with them for hours if I need to. I mean, there really isn't a topic that I'm not encouraged and able to work through with my patients here. The education that I had at USF has really been useful in allowing me to see the patients as a whole person. One thing I love about teaching addiction medicine and substance use disorder is that now it's not just me sitting in one room with one patient at a time, but it is me standing in front of a classroom with young minds, allow them space to talk about their stigma and their feelings about opioid use disorder, make space to kind of dismantle that and then rebuild up this narrative where students are hopefully going to go out in the community and approach each individual patient with compassion, empathy, curiosity. You can make a difference on a macro level by starting with just one student or one patient and going from there.
People know when somebody's gone to USF by virtue of the kind of care that they provide. But I think what that is rooted in is our Jesuit values. All of the things that make us who we are as humans, we focus on attending to each of those in providing care.
Having that focus of care for the whole person has truly redefines the care I want to give to my patients.
I think it's important that we as providers, especially in this field, never turn anyone away, that we always make space for them.
We're actually bringing together all of these disciplines to really look at the problems in healthcare holistically.
That's health behavior, preventative health, that's patient advocacy, and this is health literacy for people. So bringing those all together kind of worked out perfectly for my program I was in.
I just kind of wanted to be that middle person that kind of absorbed everyone's knowledge, educated other people, and that collaboration at USF just across the different schools really made that possible.
It allows us to leverage the unique attributes of each profession to ensure that we're able to provide care to the whole person, mind, body, spirit.